a doctor's guide for men over 60 on safe self-pleasure, the hidden risks of timing. Imagine enjoying a quiet moment of self-pleasure after waking up on a peaceful morning. It's a normal behavior that you believe is safe or perhaps even beneficial to your health. But what if I told you that this seemingly innocent behavior could pose a hidden threat to your life or health if you are a man over 60? I am Dr. Javier Castillo, Senior Medical Research Consultant at the National Center for Health Advancement, and I have spent decades researching health issues specific to older adults. My research has uncovered surprising facts about how common behaviors, even intimate ones such as masturbation, can have unexpected consequences if done incorrectly. One case continues to trouble me. A 79-year-old man was found dead in his bedroom. He died of something far more private than a fall or a heart attack in his sleep. I discovered the 7 most dangerous times of day for older men to indulge in self-gratification because of this tragedy and other similar incidents. I share these important insights in this book to provide you with knowledge that can protect your safety, peace of mind, and hearts, not to scare you. You can safely enjoy intimate relationships into your 60s, 70s, and beyond by being aware of your body's rhythms and vulnerabilities. Your health deserves it, so let's approach this sensitive and important discussion with an open mind. Why timing matters. A new look at an old habit. Our bodies undergo subtle but important changes as we age. The brain, heart, and arteries don't react the same way they did when we were younger. Behavior that was once instinctive now requires mindfulness, especially for something as emotionally and physically intense as masturbation. This is about safety, not embarrassment. The danger lies in the timing of the act, not the act itself. Certain situations or times of day can put extra stress on your body, which can lead to serious consequences such as fainting, heart strain, or worse. I have personally witnessed the effects of these risks. Take, for example, my 68-year-old patient, John, an active retiree who enjoyed quiet evenings reading and morning walks. After a special moment one morning, he told me about a dizzy spell that left him shaken. He didn't think much of it, dismissing it as just getting older. But tests showed that his blood pressure had risen dangerously during that time. Stories like John's prompted me to learn more, and what I discovered was alarming. Certain times of day can turn normal behavior into a health risk for older men. Let's start with one of these times that may surprise you, and take a look at these 7 critical times. The 7 dangerous times to enjoy. 1. Heart at risk. Early morning rise, 4 a.m. to 6 a.m. Imagine the world is still asleep at the crack of dawn. Doesn't that sound like the perfect time to spend some time alone? However, the period from 4 a.m. to 6 a.m. is among the most dangerous times for men over the age of 60. Your body automatically raises your heart rate and blood pressure during this period, known as the morning surge, to prepare for the start of the day. This increase is smooth for younger men. However, it is a critical moment for older men, whose hearts may be more fragile and arteries less flexible. Masturbation and other forms of sexual stimulation raise blood pressure and heart rate even more. It's like pushing a cold engine to the breaking point when you combine this with the morning rush. This is supported by medical reports showing that some elderly patients found unconscious in the early morning hours had heart attacks or strokes as a result of increased stress on the heart and blood vessels. According to one study, cardiologists noticed that sudden cardiac events were more common during these hours, especially in men who already had heart problems. How to stay safe. Wait until your body has settled down, which usually happens around 10 a.m. Your heart can avoid unnecessary stress by simply waiting a little longer. If you wake up early, drink a sip of water, do some stretching exercises, and let your body adjust to the day before doing any strenuous activity. 2. Risk of double dip in the post-medication period, 1 to 2 hours after taking blood pressure pills. Many older men take blood pressure medication first thing in the morning, which usually reduces strain on the heart and can save lives. However, you may experience a sharp drop in blood pressure within an hour or 2 after taking these pills. You are at risk of experiencing the double dip effect when you combine the cardiovascular demands of masturbation, which include increased heart rate and vasodilation, blood vessel dilation, with hormonal changes. This can cause a lack of oxygen to the brain, which can lead to dizziness, fainting, or even falling. I remember one patient, Robert, who fainted in the bathroom an hour after taking his morning medication. He was lucky that his wife called for help after hearing a thud. Some people, especially those who live alone, are not so fortunate. Fainting in a private setting increases the risk of brain injury, or worse, due to a delay in necessary medical care. How to stay safe? Before indulging in self-gratification, wait at least 2 hours after taking your blood pressure medication. This allows your body to adjust to the medication's full effects. Record your medication times in a diary so you can organize your time appropriately. 3. Risk of heat shock after showering with hot water. Warm water relieves muscle tension and relaxes the mind, making a hot shower feel like a small luxury. However, the seconds immediately after showering with hot water pose a serious risk to older men. Arteries dilate when exposed to hot water, which lowers blood pressure and diverts blood flow away from the brain. Your body has difficulty coping with two stressful processes, cooling down and controlling your heart rate, when combined with the physical intensity of masturbation. This combination can lead to heat shock, palpitations, or even arrhythmia, abnormal heartbeat. I have heard patients report feeling dizzy or lightheaded after showering, unaware that their bodies were under stress. Serious injuries have sometimes resulted from fainting in the bathroom, which is a hard and unforgiving surface. How to stay safe. After a hot shower, wait 30 to 45 minutes before doing anything intimate. This allows your blood flow and body temperature to return to normal. To minimize vasodilation, consider showering with cool water or make sure your bathroom is well ventilated. 4. Late at night, 11 p.m. to 2 a.m., a danger to the mind and body. It feels safe to spend quiet moments at home late at night. However, there are many unspoken dangers for men over the age of 60 at this time. As we age, our brains become less alert at night, slowing response time and making it difficult to maintain balance and coordination. Your already weakened body may have difficulty recovering from the physical and hormonal changes caused by masturbation, increasing the likelihood of dizziness or falls. Michael, a patient I once consulted, stumbled in the dark after reaching sexual climax and sprained his ankle. No one noticed the injury for hours while he was alone. In addition to the physical risks, emotional vulnerability, the loneliness or depression that can set in when everything seems stagnant can be a motivator for late-night masturbation. This can result in compulsive behaviors that mask deeper emotional needs. How to stay safe. Set aside time for yourself early in the day, preferably between mid-morning and early afternoon, when your body and mind are more alert. If loneliness is driving your behavior, talk to a friend about it or consider seeking professional help to deal with these feelings head-on. 5. Early morning dehydration. The standing trap. Your body is often slightly dehydrated when you wake up in the morning. Hours without drinking water cause your blood to thicken and your circulation to slow down. This makes older people more prone to orthostatic hypotension, a sudden drop in blood pressure that occurs when standing up or changing position. Due to its cardiovascular demands, masturbation can exacerbate this condition and increase the risk of fainting, dizziness, or falling. I have seen this happen to patients who felt fine one moment and then fainted, confused by how quickly their body betrayed them. Falls are one of the most common causes of injury among older adults, and because these incidents are often private, help may not arrive in time. How to stay safe. 15 to 20 minutes before engaging in any intimate activity, especially in the morning, drink a full glass of water. As a reminder, keep a bottle of water by your bed. This simple routine can prevent a dangerous drop in blood pressure and restore fluid balance. How to stay safe. Move around for a few minutes before engaging in any intimate activity. You can do stretching exercises, walk around, or perform simple arm and leg exercises. This stimulates blood circulation, reducing the chance of a clot or dizziness. To maintain healthy blood circulation, incorporate regular exercise into your daily routine. 6. Poor circulation after sitting or lying down for long periods of time. Long periods of inactivity, such as reading, watching TV, or napping, can cause blood to pool in the lower part of the body, especially the legs, as we age. The cardiovascular system may be subjected to excessive stress due to intense and sudden physical activity, such as masturbation, which can lead to a sharp drop in blood pressure or the possibility of a blood clot. This risk increases with age. A colleague of mine recounted the case of a 72-year-old man who experienced severe dizziness after masturbating after spending a long time sitting down in the afternoon. He almost fell, but fear made him reconsider his routine. These risks are increased by sedentary lifestyles, especially for people with circulatory disorders. 7. When feeling emotionally vulnerable, the psychological trap. Emotional difficulties such as loneliness, sadness, or the silent pain of an empty home are common as people age. Masturbation becomes a coping mechanism for some people, providing temporary relief from sadness. Although the physical act is normal, using it to numb emotional pain can lead to a vicious cycle of dependence, where the dopamine rush is short-lived and you end up feeling empty. Thomas, a widower I worked with, used self-gratification to numb the pain of losing his wife. Gradually, he distanced himself from his friends and family as his mental health deteriorated. It's not about feeling guilty, but realizing that the habit masks a deeper need for healing or connection. How to stay safe. Think about what motivates you. Are you trying to avoid pain or seeking happiness? If the answer is the latter, consider taking small steps to connect, such as calling a friend, joining a community group, or visiting a therapist. Emotional health is just as important as physical safety, and both require attention. Encourage safe self-pleasure. After age 60, aging is about adapting to your body's changing needs, not giving up intimacy. Although masturbation requires awareness, it can remain a happy and joyful part of your life. Here are some tips to make it healthier and safer. Choose the right time. Your body's at its most stable and alert between 10 a.m. and 2 p.m. Avoid staying up late at night, waking up early in the morning, and the hours immediately after taking medication. Drink plenty of water. To promote blood circulation and avoid dizziness, drink water 15 to 30 minutes before engaging in any intimate activity. Create a safe environment. If balance is an issue, make sure there is adequate lighting, non-slip surfaces, and a sitting or lying position. Be cautious with medications. To reduce the risk of low blood pressure, wait at least 2 hours after taking heart or blood pressure medications. Warm up. To increase circulation and reduce stress, do some gentle stretching or movement before you begin. Assess your emotional health. Make sure your actions are driven by happiness, not escape. If loneliness is driving you, seek connection through conversation or support groups. Listen to your body. Slow down, breathe, and pay attention to signs of fatigue or discomfort. Rushing increases the risks. Personal story. Learning from loss.
I will never forget a conversation with Maria, the daughter of one of our patients, who lost her father to a heart attack at 5 a.m. The coroner's report indicated cardiovascular stress during a moment of stress. Maria was devastated, not only by the loss, but by the realization that a simple conversation about timing could have saved him. That moment reinforced my mission to share this knowledge. It's not about fear, it's about giving you the tools to live a full, safe, and confident life.